This is another complex case. It's a long time to explain it. One other case I want to show you. I'm showing you all the jewels. Look at this. What do you have? Two ophthalmic connected inside orbit. Dorsal ophthalmic, primitive ophthalmic. Because this is already connected, so this is not ventral at all. It's primitive ophthalmic.
So my case will be, I will present two cases of ventral ophthalmic origin. They were not my cases, but I got them from my professor Sang. He provided me these cases, so I tried to collect such data related to the ophthalmic artery. So the first case, this gentleman, he's 69 years old, found to have meningioma from the MRI. So transfemoral cerebral angiogram was requested for him. So we can see here the meningioma with the CSF cleft and exophytic looking. So we have done TFCA for this gentleman, and as we can see here, through the ICA, it was from the left side ICA, this one, left ICA. As we can see here, supposedly that we expected to see the ophthalmic artery from the siphon or from the siphon of the carotid ophthalmic segment, but as we can see here, which is unusual looking of the ophthalmic artery. So at that time, 3D was done. So we can see here clearly that it is rather originating from the carotid ophthalmic segment or siphon. It's originating from the ACA, but here it's more prominent that I can get a CT scan, enhanced CT scan, which it confirms that it is originating part from the ACA, mostly at the A1, from the A1, and this is an unsubtracted image that we can see that this is probably fronto-orbital branch, but here is this is the branch of the ophthalmic artery, as we can see here from the A1. So this is another patient. This patient, 47 years old, gentleman, with he presented to the ER with the left side weakness, and MRI revealed that there is right MCA occlusion. So after the MRI have done, so a transfemoral cerebral angio was requested. So incidental finding again, as we can see here. So this is again left side. So we can see rather origination the normal or the mostly appeared ophthalmic artery from the carotid siphon rather than this. It is originating from the ACA, as we can see here. So even through the 3D reconstruction, and here it's more prominent. So here it's like it's an oblique view from like an axial cut. So this is the MCA, which has occlusion, as we can see here, and this is the carotid and then bifurcation. So this is part of the ACA. This is the A1. So as we can see here, this is the origin of the ophthalmic artery. And even here in the lateral reconstruction, lateral projection, we can see that it confirms presence of the ophthalmic artery from the A1. And I tried to just revealed how does it look like from the left side and from the right side and from the left side from the MR angio, but it's not. I think the 3D will be much better performing and just revealing the anatomy. Yeah. So this is the right from the A1, and this is the left at the level of the carotid. So this is the right side. So again, this is ophthalmic, and this is again MCA and ACA, and this is the ophthalmic origin. So I think this is the last one, yes, theory, which as we can see here, this is the internal carotid artery, and this is the siphon, and this is a part of the cranial branch and a caudal branch. This is at the embryology level. This is the cranial branch is remnant of the ACA, while the caudal is PCA. At the beginning, that we have a ventral and dorsal primitive ophthalmic artery. So the ventral ophthalmic artery originating from the cranial, while the dorsal from the carotid siphon itself. And then as we can see here, the ventral one. So again, as I mentioned at the beginning, there were two primitive ventral and dorsal ophthalmic arteries. So the ventral from the cranial and dorsal ophthalmic artery from the carotid siphon. So the ventral, it is entering the orbit through the optic canal, while the dorsal, it is entering through the superior orbital fissure. At some point, both of them, they meet at one point intraorbital anastomosis, as we can see here. And then eventually the ventral ophthalmic, the primitive ventral ophthalmic artery, it has another anastomosis at intradural anastomosis, as we can see here. And then eventually regression of the ventral ophthalmic artery occur, and as well as the dorsal as well regression, and the dorsal will be a remnant of the inferolateral trunk at some point. So we can see here, and then after regression of the dorsal and ventral, so we have like adult type of the ophthalmic artery. But there is meanwhile at this process there is another branch, the supraorbital artery, which is coming from the stapedial artery. Again, it has takes place through the superior orbital fissure into the optic canal to contribute into the orbital arterial feeding. And then eventually again it regresses at this artery, and yeah, as we can see here, this is the remnant and of the adult ophthalmic artery.
So with this picture, we can explain most of the variations.
Exactly. So yeah, this is because last one, yes, I think theory it's more applicable with the reported cases. So if there is a like failure of regression of the ventral, so maybe it reveals those cases I have presented if they are really ventral one, and failure of the regression of the dorsal. This is more commonly that we can see from the carotid siphon.
Let me just show you one case. The carotid artery giving off this branch, this is eventually going into
Inferolateral trunk, or could it be
becoming ophthalmic artery. Inferolateral trunk is at the cavernous segment. It is far below. There is a small bunch going backward. So this is before the cavernous sinus. What I think is happening is this is the pathway. This is trigeminal artery. The main trunk of this is trigeminal artery. Because a branch going backward, you can see the separating branches. And the other branch is connecting to middle meningeal artery, and then going through the inferolateral trunk connection, again, dorsal ophthalmic artery. Here put a name as trigeminal meningeal remnant. It is complex. Usually, trigeminal artery has an osmotic branch with this inferolateral trunk, middle meningeal artery. And this connection is remaining, and as you can see here. This is another case. The guy from South America gave it to me. You can see ophthalmic artery is coming off from the basilar artery. Basilar artery is giving off ophthalmic artery, same pathway as trigeminal, middle meningeal, dorsal ophthalmic, and ophthalmic. This is case. Internal carotid is not there, and only this branch is giving off the ophthalmic artery. This is going through kind of dorsal ophthalmic course. This is external carotid artery injection. What do you see here? Accessory middle meningeal, dorsal ophthalmic, ophthalmic. This is anterior cerebral artery. So this is true connection between the dorsal ophthalmic to ventral ophthalmic anterior cerebral artery. I never seen case like this. This was I did an angiogram in 84, 85. This is another complex case. It's a long time to explain it. One other case I want to show you. I'm showing you all the jewels. Look at this. What do you have? Two ophthalmic connected inside orbit. Dorsal ophthalmic, primitive ophthalmic. Because this is already connected, so this is not ventral at all. It's primitive ophthalmic.